Professor of Emeritus, Dr. Muralidhar Sharma stands as a symbol of wisdom, dedication, and lifelong learning. Though through the decades of passionate teaching and scholarly excellence, he has inspired generations of students to think deeply, act ethically, and pursue knowledge with purpose. His classroom was not just a place of instruction, but a space where curiosity was nurtured and young minds were shaped to face the world with confidence and integrity. So, sir is a living example how Ayurveda can make change to each one's life. So, it's an honor to listen to you, sir.
Thank you. Now, at the outset, without wasting much of the time, I thank Dr. Giridhar Kaje, at the same time congratulate him also for this achievement and giving me an opportunity to be with you people at this August occasion. I was supposed to talk about something inspiring, but I don't know how I inspire anyone else. My field of surgery is, my field of medical practice is Ayurvedic surgery. So from that point of view, I thought of giving a message about Ayurvedic surgery to the society. Now, in the present day in the society, there is always some question mark when you say that there is Ayurvedic surgery. It's unfortunate, though we know that the surgery was initiated, rather the whole science of surgery was initiated in India by Sushruta, but that's all the history part. But in the current situation, we are in a situation where the people will be questioning like whether Ayurveda has a surgery or not. It has gone to the level that it is also questioned in the judicial matter, and the issue is sub judice now. At this situation, there is one important issue, like how Ayurvedic practitioners or how Ayurveda should be related to the surgery in the present day situation. The present surgery is a technically enormously developed surgical field, and almost every area is now under the scalpel of a surgeon. And in this situation, how an Ayurvedic practitioners can find or show the utility of Ayurvedic surgery in the present day situation, that is a major issue. In the present medical setup, there are two very important debates which are going on. One is about the availability of surgical facility to the people. And India is considered one of the areas where the availability of surgical facility is considered to be lesser, and this is considered to be one of the issues of health policy makers. At the same time, there is another very important debate which is not really focused many times, is about the unnecessary surgeries. Number of surgeries being done is much more than what's really needed as such. Next. Now, the data is saying, that as per the data, it's not my data, the number of surgical interventions being done throughout the world is increasing rapidly, and it's expected that the total burden, now it's not only the impact of surgery, I'm not talking about the pain and other issue, it's about the economical impact of the surgical treatment on the society and how it produces a burden in a country which is yet developing, where the GDP is not so very high as such. That's one of the important debates as such. Now, in this situation, one of the concern among all the specialists of surgical field, I'm not talking as an Ayurvedic specialist now, it's about all the medical issues, is about the conservative surgery. I think, there is sound hard. So, probably I am able to reach all, right? So, the issue is about the conservation which is required to be surgery. The number of surgeries being done now is really more than what's needed. This is one of the issues. And it's not me alone who says about it. You have plenty of references, the scientific articles which are showing the concern about this. I have selected a few sentences from some of these. Now, very important, if at all you are interested, now many of you may not accept like what I say is true, you may go through these references, selected articles in empowered journals, as it, peer-reviewed journals of high esteem. The concern, one of the important concerns in the present society is about the need of conservation in the surgery, unnecessary surgery being done. Now, I will not go into that part, like why that unnecessary surgery and how all that. That's not the, or rather, that kind of a discussion may not be possible with this time limitation. Now, and this also again, a set of these scientific articles, those who are interested may copy down these references and go through these articles and see the gravity of the issue. Now, it's not only in the scientific field. The issue of unnecessary surgery has come to the field of general media also. You see many of the press reports which are suggesting about these incidences. I will not go into the technical details of that, but it's about it's about the need of the surgical conservation, one of the new thoughts, rather the latest thoughts in the field of advanced surgery. Now, in that kind of situation, what Sushruta has said is very relevant. The principle of Sushruta, Ayurvedic surgery, is यदि यत्र शस्त्रसाध्येषु स्नेहादिक्रिया न प्रतिषिध्यते परन्तु स्नेहादिक्रिया साध्येषु शस्त्रकर्म न क्रियते. In any disease condition, whenever you have an option other than that of the surgery, that should be tried to the maximum extent. And you will never do surgery, or you will never intervene with the physiology of the body in those conditions where there is an alternative other than that. But intervention is definitely not done in those conditions where a medical possibility, non-surgical possibility is possible. And this is the basic principle of Sushruta, and that's the Ayurvedic surgery. Now, unique nature of Ayurvedic surgery, of course, in the present day situation, from Ayurvedic surgery point of view, Kshara Sutra, unorectal surgeries, these have become almost now popular, and few raise the question about these issues. But when it comes to the question of surgical treatment of other conditions, there is some question raised like whether Ayurvedic has surgery or not, and those are the issues. Now, from the theory point of view, the whole evolution of concept of surgery in Ayurveda is a gradual step-by-step development of the intervention. From Charaka Samhita, the quote is the whole approach of the treatment would be of 3 stages. Antaparimarjanam, Bahiparimarjanam, then the Shastra Chikitsa. Antaparimarjanam is correcting the defects in the body, lesions in the body, by giving some medicines from external source so that the pathology subsides by itself. When this is not possible, the next level of intervention would be trying to separate these entities, pathological entities, and then make them expel out the Shodhana procedures, Vamana, Virechana, Basti, etc., where the doshas which are producing the disease entity, they can be separated by a specific procedure of Pura Karma, and then they are expelled out. Now, when this also is not possible, then there is a scope for a direct intervention, and that is a Shastra surgery. So, it's a gradual, step-by-step development of intervention in the body. And medicine and surgery, they are not two separate entities. They are one and same, rather. When one is not possible, the next step would be, and the surgery is supposed to be the last step. And when Charaka would say, when all that medical limits are met with, and there is no further scope for medical intervention, then you refer the patient to the surgical treatment. Now, the whole surgical steps, now those who are in the Ayurvedic field, they know about the Ashtavida Shastra Karma. That Ashtavida Shastra Karma also is evolved in the similar concept of a stage-by-stage intervention. The first of the stage of this surgical treatment would be removing the blood which is vitiated, Rakta Vistravana. Rakta Vistravana, where you will be removing the vitiated Rakta as well as vitiated blood, as well as the components which have produced the vitiation, maybe some amount of the normal blood also. But for this again, you need to have a separation of the pathological entities, which may not be possible in all diseases. When of course, once there is a pathological lesion in the body, there is a natural effort of the body to separate that pathological entity and expel it out. When the entity is separated in the form of a pus, then it can be drained out. That's bherana. If the pus also is not formed, there is a decay of the tissue and it cannot be separated, then you assist the body by chelana, removing that tissue which is separated, or it may be curated out. If the quantity is small, it can be curated out. That's the lekhana. Then, of course, you have the other procedures. Yeshana is a mechanical procedure of searching for the lesion, and aharana is extraction of that object which can be identified. And last, of course, sivana, the suturing, because every surgery would end up with a wound, and hence the wound has its suture. And hence the steps of surgery evolved in Ayurveda is a very classical method of step-by-step intervention, starting from the basics of medicine to the level where the pathological entity can be removed. And it's very important is as medicine and surgery was totally integrated. There was no difference. Compared to that, if you go into the history of Western surgery, the Western surgery history starts with barbarian surgery. The field of surgery was in the hands of barbers, and the barbers were not considered as medicine person at all, physicians at all. And of course, I will not go into much, and all this, my purpose is not to degrade the current system, but it has evolved with a situation where medicine and surgery were totally bifurcated. They were almost considered to be in watertight compartments. And the traces of that is seen till very recently. Fellow of Royal College of Surgeons is not allowed to add the suffix of doctor. He is still called as Mr. And very recently they have changed that. That means there is a basic bifurcation in the idea of medicine and surgery. They are considered to be totally two different areas. Compared to that, Ayurvedic surgery has evolved as a continuous step-by-step progression of the medical science. This is one of the important issues. Of course, in the present day situation, modern surgery has developed very well. When I say all this, it's not to undermine the value of the modern developments in the surgery. It has developed, it has really helped the humanity, but at the same time, one of the offshoots of this would be the unnecessary surgery. And this is one area where the principles of Ayurvedic surgery can really save the patients. And hence, in the current situation, one of the basic issues which can be really relevant would be a non-surgical intervention of surgical conditions with Ayurvedic treatment protocols is possible. Now, all that I would try to do is how this can be substantiated. Then, pre- and post-operative management. Ayurvedic treatment protocol can reduce the complications of the surgery. In the post-operative management, Ayurvedic drugs or Ayurvedic protocol can reduce the need of many of those medicines or these unnecessary adverse effects of the medicines. Healing can be better. Rather, you have a specific treatment protocol which can really improve the healing in Ayurveda, whereas contemporary surgery doesn't have such a protocol where the healing is directly promoted. All that would be the factors like you provide vitamins and then expect the healing, but that's not the issue. Of course, contemporary surgery has developed with the concept of antibiotics and safe anesthesia. Safe anesthesia and the antibiotic treatment protocols, they have helped a lot in the development of the surgery. It's not only that much. There was a very systematic method of development, and that systematic method of development is lacking in the field of Ayurvedic surgery. Otherwise, Ayurvedic surgery would have that very valuable advantage. Then there is another very important area is the management of post-operative complications, and based upon principles of Ayurveda, certain of the innovative approach is possible. Now, all that I would try to do is within next 20 minutes, I will not take more that time. I will try to give some examples of that. One of the examples, this is the data from my own clinical practice. When I started practice in 1983, the number of hemorrhoids conditions managed with the intervention, surgical or Kshara-Sutra, they were more. That red color in the column shows the scope of that number of incidents of the surgical interventions in the hemorrhoids. Whereas India have collected that up to 2019. From that on, they onwards, because I am retired from the service, the data are not mentioned maintained in the same proper order. The number of hemorrhoids cases which I see is increasing multiple folds, but number of surgical interventions proportionately is reducing. So people now come to me to search an alternative possibility of a treatment other than that of the surgery. And this also gives the other advantage. The advantage is the number of patients whom I see is manifold increasing. It's not only in the hemorrhoids. I have given a few examples. It's not that it may not be possible to give the data of all the patients. With the appendicitis, it's the same issue. With the Ayurvedic management protocol, the number of patients who were treated with surgery in the initial days of my practice, number of patients who are treated, the third column shows the number of patients who are treated without surgery with our Ayurvedic medical protocol. Now, this shows the advantages of the Ayurvedic principles as such. At the same time, it's also possible now, I will not go into that kind of data, but in general, the common conditions where definitely the surgery intervention can be reduced significantly with the Ayurvedic treatment protocol, like IVDP, cholecystitis, renal calculi, prostatic hypertrophy, IHDs, diabetic foot, varicose veins. These are all certain of the conditions where we can produce a significant change. When I say this, I don't mean to say that none of these conditions would require surgery. But indications for the surgery, the specific indications which are the standard protocols, their benchmark can be raised enormously. Like in IUDP, if the diameter of spinal canal is less than 4 centimeters, modern surgeons would advise surgery. But I would continue up to 2.5 centimeters with our medical treatment and the patient can be benefited. So that's the scope is increasing. But at that limit, beyond that limit, if there is a neurological deficit, definitely the surgery would be required. So it's not that undermining the value of surgery, but giving an opportunity to the suffering humanity to avoid the suffering of surgery as well as the cost burden. That's the important issue. The common modified guidelines which I would be using in my practice is the spinal surgery is advised only when there is a real motor deficit. In the BPH, if the residual volume is more than 250 ml, whereas the standard urological practice is 100 ml, if it is more, residual volume is more than 100 ml, surgery is advised by urologists. But I would be waiting up to 250 ml with the Ayurvedic protocol. Many of such patients can manage it without surgery. Similarly, cholecystitis, in a acalculous cholecystitis, surgery is definitely not required. Even in a calculous cholecystitis, if the wall thickening is less than 14 mm, surgery can be avoided. In the same way, diabetic foot, limb saving approach, number of limbs saved where amputation were recommended elsewhere, that's also quite huge in number. And amputation is the last resort. If necessary, if it goes to that inevitable situation, definitely yes, I would do the amputation too. So when I say that amputation is not required at all, that's not true. But the scope of range of conditions where amputation could be needed can be reduced. Similarly, effective management of postoperative complications. Now, that's step-by-step areas which I have suggested. The postoperative complications like neurological deficits of neurosurgery. See, neurosurgery may be done elsewhere, but patients will have residual defects and they can be definitely better managed. Quality of life can be improved. I don't say that it can be cured. They can be improved with the Ayurvedic treatment protocol. Similarly, post-cholecystectomy syndromes, an area where only Ayurvedic treatment can help. Patients who have developed post-cholecystectomy syndromes, no modern medical treatment can help. It is only the Ayurvedic treatment which can help. Similarly, post-hysterectomy syndromes, which also are quite common now these days. Hysterectomy and cholecystectomy have become very common, and such incidence also is increasing. and that's how we get more number of patients also. Then intra-abdominal adhesions after surgery, that's another area where modern surgery has absolutely no solution at all, whereas a treatment protocol under the concept of Gulma can definitely help the patient recover. I again say that the adhesions will be removed. It's not the question that adhesions will be removed, but patient can have a healthy life and quality of life can be improved. Similarly, surgical site infections where the healing has failed. And Ayurvedic management can change the total outcome of surgical interventions. So there is an area where Ayurvedic treatment definitely has some significant advantage as such. Now, I'll give you a few examples. Now, this is one case which came to me in 2017, 26th December 2017. The history is very brief. A young man had a road accident and he had a very complex fracture of the ankle joint. He was treated in some modern hospital, tertiary hospital in Mangalore, and his amputation was done at the ankle level, joint level. Initial amputation was done. But later in the post-operative period, patient developed vascular complications. There was a significant blockage of vessels, and there was a need of revision of the amputation. A second amputation was done at the below knee level. But unfortunately, at that condition also, at that stage also, the patient continued to have the complications of necrosis, and the Doppler study showed a blockade even at the femoral artery level. Now, at this stage, naturally, the patient's party, they were frustrated, and by the time, this time, their resources also are exhausted, and I usually say, jiska koi nahi hai, uska to SDM hai yaaro. So, when the patients are frustrated as a last resort, they usually come to our hospital, SDM hospital, and this patient came with that. And very interesting issue, another important issue is, when the patient was discharged against medical advice from that reputed hospital, the doctor, and when they said that they are going to an Ayurvedic treatment, the patient's party had given an undertaking that for all the risks involved in the next treatment, I would be responsible. Anyway, that's the other part. Now, issue is not a very important issue, but it also has some significance. Now, when the patient came to me on 27th, 2017, the status of the wound, you can see the necrotic tissue. Virtually, the stump was dehisced and foul-smelling discharge was there. Of course, I did give an antibiotic, oldest antibiotic, gentamicin was given, because by this time patient had been treated with all the other antibiotics. Virtually, without any cultures in treatment, I started with the oldest antibiotic which no modern surgeon would prefer at that stage. And of course, we started with the Manjistadi Ksharavasti, Manjistadi Basti, on the idea of Vatarakta, so that the blood circulation whether improves or not. Now you can see the follow-up. By 28th, the third day, there was a good vascularity, the dead tissue was lesser, and by 5th day, almost we had a healthy wound. So all that I did was resutured on 2018 January, and the wound healed well, and now the patient is able to walk with support and leading a normal life. This I am not just to highlight, the purpose is not highlighting about it. There could be a question like, what would have been the advantage of that 6 inches extra leg? If the amputation was done above knee, what would have been the loss? It's not the issue. Even with that, maybe the patient might have recovered very well, but issue is about the stress and the consequences of a third amputation. Not simply the physical, psychological, economical stress also, that can be avoided when you follow that. That's one of the examples. Similarly, I will give another example. This is an example in the post-COVID period. A woman was given COVID vaccine. Within 3 days of the COVID vaccine, she developed, and in some other hospital, she developed extensive gangrene of the foot, both the foot. She had a gangrene in both the legs, and at that situation, naturally, the suggestion would be amputation of both the legs. Now this again is a very critical issue when amputation of both the legs in a patient who was otherwise healthy a week back. The stress would be quite huge, and naturally in such a situation patient would always opt for some other alternative, and the patient came with that idea. Now in this patient I didn't do any surgery. It was a Tifalakvata Parisheka, and then of course Manjastadi Vrsti was given, and a gradual slow step-by-step debridement in a span of 15 days. And of course last photograph is not, I couldn't find the photograph, somehow I missed it. The patient had a good healing at that level. The maximum was the toes were amputated. Patient would still walk with the feet. There was no need of an amputation. And this again is what Ayurvedic surgery can do. It's not Muralidhar Sharma, it's about Ayurvedic surgery which can do. One more example now. That's about the two examples where the Ayurvedic surgery produces a dramatic, very significant issue. I can quote hundreds and hundreds of such cases, but I have just selected only one or two of that sort, which could be really showing the value of it. Now one more of the patient. Now this again is a patient who had been diagnosed with the stromal tumor of the intestines, and in a reputed hospital nearby, she was suggested the enterostomy surgery. Enterostomy is where those who do not know, you put in a tube directly into the intestine and feed that patient with the tube only. And even with that, the survival period in that patient will be less than 2 years. Now, as usual, by the time the diagnosis was over, the patient had exhausted, and the patient came to us as such. And very interesting in this issue is, patient had developed all the signs of gastrointestinal tract obstruction. Patient was totally on parenteral fluid. So when the patient came to me, I did that. The patient was maintained only on IV fluids. But during the rounds, when I saw the patient repeatedly, what I found was the whole mass was easily palpable. And if I twist the mass, the patient would pass the flatus, and for that day, patient will also pass the stools, and the IV fluid could be reduced. If I do not twist, if I do not turn the mass from external over the abdominal wall, patient would develop the obstruction. So I got that idea that there is a mechanical issue which has to be managed than really the malignant issue. The malignancy, of course, is there, which cannot be treated. The size was quite huge and so on. So I insisted upon the patient that we will do a laparotomy and see whether it is possible. And the patient was an old lady. She was absolutely against a enterostomy, living with enterostomy. So I said, either I will not do anything or I will do something which can help you. Now I opened the abdomen. The mass was quite big. It was almost the size of the kidney, 4 into 4 centimeter size, adhered to the intestines. And what I did was, virtually, removal is not possible. Removal virtually was not possible. What I did was, that the whole mass was fixed in the anterior abdominal wall, below the periosteum, something which no surgeon would do anywhere. If still any conventional surgeon hears about it, he will just say that you have to be sewed. But it was an exteriorization technique, which is actually a principle in case of the intersections. The intersected colon loop would be exteriorated. I did this to the mass, and the patient was maintained with the further, and the patient was maintained on oral fluid. Patient recovered, and patient survived for almost 3 years. After 3 years, of course, patient succumbed due to a cerebrovascular accident later. That's another issue. During these 3 periods, the 3-year period, all that I have given medicines were Kantana Ragukula, Arogyavardhini, and which would be costing less than 7 rupees per kilometer per day. Whereas if at all a contemporary surgical protocol, it would be the prescription of imatinib. Imatinib at that time, now this rate is mentioned about our older rate, 3,200 rupees for 10 packs. Of course, very recently the rate has reduced, now it's 1,800. Anyway, the cost of the treatment per day would have been enormously different. and the average success rate of enterostomy with the immune modulator, that imatinib, would be 10 to 12 months. Patient had survived for 3 years. Mass was there. Every time the patient, when she came for follow-up, she would be asking, like, how is my child? So that she was so well rather accustomed with that kind of a mass. She learned to live with the mass. And they had a very grand marriage of their granddaughter. And I was one of the chief guests in that marriage. There was more attention on me than this couple asset. So that was a very interesting issue, the different issue. But the issue is about this. Of course, this patient was presented live in a conference which we held, conducted on malignancy in SDM there at the time. So that's about the advantages, which is, I think, within the time limit I would like to conclude. The point is only that much, like Ayurvedic treatment protocols can modify the indications and outcome of surgery. And the principles of Ayurvedic surgery are not only relevant today, but they are for the welfare of the humanity, which we need to preserve. And Ayurvedic culture has to develop and propaganda, maybe reach out to the society, those which are their discipline. This concept needs to be reached to the society, which is a near need. Modern surgery has developed because of a systematic effort of all the people, not by one or two. Now that kind of a systemic effort is required from Ayurvedic surgical point of view, and I hope some or other day this is possible. And of course, the last would be doing less in Ayurvedic for a surgeon would give you more name. Interesting. That's all. With this, thank you again, and thank you for the opportunity. I hope there may be some questions. If there are any questions, I am ready to answer the questions. Otherwise, I will conclude. Are there any questions?
We thank Dr. Muralidhar Sharma, Professor of Emeritus, for his elaborative keynote address. I request Dr. Giridhar Kaje and also Dr. Jaiprakash Narayan sir to felicitate Professor Muralidhar Sharma sir. It's a great honor to listen to such stalwarts of Ayurveda. Now, moving on to the next session, that is technology talk in Ayurveda. I would